Good morning. Thank you for joining us for today's virtual Healthy Conversations. My name is Jen Harvey. I am the nurse navigator for the Lung Cancer Screening and Care Program at YRMC. That's pretty hard to fit on a name tag, so you're welcome to refer to me as the lung screening nurse. And today's topic is about lung cancer screening and how it could possibly save your life. Today, we're going to dig into what is lung screening, how is it done, how do you qualify for lung screening, and more. I'm really excited to be talking about that this month because November is Lung Cancer Awareness Month. So let's get started. First, a little background on lung cancer. You may already know this, that lung cancer is a frequently diagnosed disease. Here is a chart looking at Arizona with our top 4 cancers: breast, colon, prostate, and then lung cancer. You can see that it's estimated for 2020, there will be 4,200 Arizonans that get a new diagnosis of lung cancer. Bottom line, it is common, and this is true across the United States. So first, the bad news. When we look at survival rates, they're not so great for lung cancer so far. It is by far the highest mortality when it comes to cancer, superseding colon, breast, and prostate cancer. But we're not going to stop there, because here's the good news. Things are changing. Things are getting better. This latest statistic that I saw this year coming out from the American Cancer Society is that survival rate of 5 years is up 5% in the past 10 years. So right now, the 5-year survival rate of lung cancer is estimated at about 22%, where it was at 17%. So why is that? I'm glad you asked. Here are the top reasons. 1, we have less smokers. Since the 1980s, cigarette smoking has been on the decline. Thank goodness, because that is our number 1 risk factor for lung cancer. Also very exciting, and this is going true for many cancers, there are improved treatments. There are whole new classes of treatments for cancer, including immunotherapies and targeted therapies. So these, along with the stalwarts of chemotherapy, radiation, and surgery when indicated, have improved the outcome for lung cancer. And then what I'm here talking to you about today is early detection through lung cancer screening. So we're going to dig into that a little bit. I think that really pointed out the answer to this question: why is lung cancer screening important? Well, the bottom line is it saves lives. So we could actually save thousands of lives each year here in the United States if everybody who qualified and was considered high risk for lung cancer got an annual lung screening. It's a CT scan. You can see what that machine looks like here. Lots of you have had CT scans before. What does make this different is it's using a lower dose of radiation, so it's called a low dose CT, and it is done on an annual basis, kind of like women and our mammograms. You get it done every year, even if you feel great, especially if you feel great. And it is proven to be the only reliable way to catch lung cancer early. Check out this statistic. Over 80% of lung cancers have a chance of being cured if they're detected early. So you remember that statistic from before? There's a 22% survival rate over 5 years. We have this opportunity to increase that to 80% if everybody who qualified for lung screening got it done. So, how is it done? You saw that CT scan. That's all it is, really. The test is painless. It's a 3D x-ray that you get to lay down for. There's no fasting. There's no IVs. You just get your pictures done once a year. You do need to get a provider's order for that, and then you follow up and do that every year on an annual basis. We're going to spend a little bit of time right here for answering this important and sometimes confusing question. Do you qualify for a lung cancer screening? When it comes to insurance coverage, they're going to be looking for three main things. Are you between the ages of 55 and 77? Do you have a history of something called 30 smoking pack years? And are you a current smoker or have you quit within the last 15 years? So let's break it down a little bit. At first, that age thing seems pretty simple. This is including Medicare, Medicaid in the state of Arizona, each state is different, and private insurances between the ages of 55 and 77. If you have the rare situation where you have a true private primary insurance, private insurance, then you are covered up to age 80. Now, a history of 30 smoking pack years. What is that? That is a simple calculation of how many packs a day you smoke times how many years you've been a smoker. So, for example, if you smoked a pack a day for 30 years, you have 30 smoking pack years. Likewise, if you were a 3/4 a pack a day smoker for 40 years, that's also 30 pack years, and so on. Really important to note when we're talking about insurance coverage, this is relating specifically to cigarettes. So if you smoke cigars, marijuana, if you vape, those things are not included in the calculation for insurance coverage for lung screening. Now, if you're a current smoker or quit within 15 years. So once again, we are referring to cigarette smoking only and current smoking or quit within 15 years. A couple other really important points. They aren't specifically stated when it comes to insurance coverage, but it's also important when you think if you qualify. We're talking about people who are willing and healthy enough to undergo treatment should lung cancer be found. And very important, this sometimes is confusing, you have no current symptoms of lung cancer. So often I hear, oh, I don't need a lung screening. I feel fine. That's exactly when you want to be doing your annual lung screening. Just like us women, we're having our mammograms. We don't think we have breast cancer. We're doing our preventative service on an annual check. So speaking of those symptoms of lung cancer, let's just run that down a little bit. If you think you have symptoms of lung cancer, you really do need to be talking to your primary care provider. This often can look like a chronic cough that's new or changing, especially if you're bringing up bloody sputum. If you're having any changes in your voice, new hoarseness, difficulty swallowing, or if you're having pain when you take a deep breath in, unexplained weight loss, these are some of the symptoms of lung cancer. If you have symptoms that are concerning to you, please talk to your primary care provider. You probably are not qualifying for a lung cancer screening, but will need a workup of some kind as determined by your provider. So let's look at that number one risk factor for lung cancer and what is qualifying people for lung screening, and that's the history of smoking. We know that over 80% of lung cancers are directly attributed to smoking. So if you're thinking about quitting, we'll have some resources for you coming up in a little bit. But what if you've quit smoking? So unfortunately, the history of smoking does increase your risk of lung cancer even when you've quit. So if you've quit, congratulations, but know that you still may need a lung cancer screening. What we're looking at here is a picture of what the CT scan actually looks like. It can be a little bit hard to see that anatomy because it's a 3D slice of your chest right here instead of the front on X-ray that we're familiar with seeing those anatomical landmarks. And in this picture, Gotta laugh a little bit. You can see that this patient still has their pack of cigarettes in their chest pocket. We also see what we're looking for on a lung screening, a nodule that looks suspicious for lung cancer. Now, the screening won't tell you that you have lung cancer. It's going to tell you you don't have any signs of lung cancer, or we need to do some follow-up testing. And in this case, that bright white spot with irregular borders was determined to be a lung cancer through a biopsy. We also see that smoking has other effects on the lungs, most commonly emphysema, that shows up as these white patches on the lungs. And it brings up another risk factor when it comes to lung cancer. COPD, emphysema, chronic bronchitis, those chronic lung diseases do double your risk of lung cancer and therefore increase your benefit for getting lung cancer screening done. Other risk factors that are not included in the calculation of whether you qualify by insurance can include some other important stuff like asbestos exposure, radon exposure, a family history of lung cancer, especially if it was an immediate family member, or if you yourself have had a history of cancer. And if any of those situations apply to you, reach out to your provider. So, you think you qualify for lung screening, now what do you do? And I also want to point out, maybe you're thinking about this in terms of a loved one, a family member, or a friend. So this information might be for them too. So if you think you qualify, you meet the criteria of between the ages of 55 and 77, you're a current smoker or you quit within 15 years, and you have that 30 smoking pack years, the next best step is to have an appointment scheduled with your provider for something called a shared decision-making visit. This acknowledges that you are the most important agent in your healthcare and that everyone's situation is different. And we want to go over during that visit the risks and the benefits of lung cancer screening. It's important to know that lung cancer screening most benefits those at highest risk for lung cancer. Unfortunately, screening of any kind does carry some risks. So we know that the number one benefit of lung cancer screening is that you are less likely to die of lung cancer. The other benefits, what I see every day, is that you get reassurance, peace of mind that you have no signs of lung cancer. And that's worth a lot. Another thing is, we're scanning a pretty large area with some very important organs. So we also get incidental information that has saved lives in our program. That might look like a new diagnosis of heart disease that you didn't know you had, a problem with the aorta coming off of the heart that needs attention, or even other cancers that are in the field of vision when you have your lung screening. Now, the risks are worth pointing out because we do see those, and we try to deal with those through national research that supports we're following national protocols. But bottom line is there is a risk of radiation exposure over time. This is a low dose of radiation compared to a standard CT, a fifth the dose. So we're really working hard at lowering that risk for you when you get your screening. But also, you can have false alarms, and those aren't to be ignored because that can be extra money, extra time, extra worry, and that happens when we find a spot on the lungs that requires follow-up testing that doesn't turn out to be lung cancer. But rest assured, we are following those national standards that help lower that risk, and we have 9 expert radiologists with decades of experience behind them that are reading your results and getting those to you. So just a quick glance here at some smoking cessation resources. If this applies to you or someone that you love, I do get to talk to people every day who are working on quitting smoking. So I hear a lot of recommendations, and top of the list is our state-funded quit smoking line, ASH line. They offer free quit free quit coach, and they offer free nicotine replacement like the patches, gum, lozenges that can all be very helpful. You can see these other websites too: lung.org, smokefree.gov, becomeanx.org. They all have different approaches, but I also want to point out that the approach is supportive, not shaming. We want to let go of the stigma of lung cancer. Nobody deserves cancer. Nobody deserves lung cancer. And all of these sites come from that point of view of meeting you where you are at to support you and help you when you are ready to quit smoking. So I want to open it up now to questions that you might have about lung cancer screening.
All right, thanks, Jennifer. The first question we have is from Joe in, looks like Chino Valley. He says, I have no symptoms, but I smoked most of my adult life until just a few years ago. Do I need to get involved in YRMC's lung cancer screening program?
Joe, that is a great question. And from what it sounds like you're the perfect candidate. You want to think about the criteria we've talked about. Are you between the ages of 55 and 77? Were you a significant smoker, estimating that 30 smoking pack years or more? And did you quit smoking in the past 15 years? And by the way, congratulations on quitting smoking. For many people, that is the hardest thing they will ever do. So it sounds like you might qualify and might be the perfect candidate. So I encourage you to make an appointment with your provider to go through that shared decision-making visit and then possibly order the lung cancer screening CT.
Okay. Diane in Prescott says, I was exposed to asbestos during my 40-year career in commercial construction. Will that qualify me for the lung cancer screening program? And by the way, I have never been a smoker.
So you bring up a really important risk factor for lung cancer, and that is asbestos exposure. To dig into that a little bit deeper, the regulations on asbestos came out in the 70s. So if that long period that you worked with asbestos was during the 70s and before, then your exposure may have been more significant than if it was after the 70s. So unfortunately, to directly answer your question, you do not qualify for insurance-covered lung screening, which is based on the cigarette smoking history. It's very good that you weren't a smoker because smoking enhances the damage that asbestos causes to the little air sacs in the lungs. So a question for you would be, are you having any symptoms? If you've had an increase in shortness of breath, then you really need to talk to your provider about a diagnostic workup related to asbestos in the lungs. But the lung cancer screening itself would not be an appropriate test for you at this time.
Okay, great. Let's see, this one's from Tom. He says, I'm not eligible for Medicare for another year. Do you know how much it would cost me to participate in the lung cancer screening program?
Well, thanks for that question. So Medicare for many people starts at age 65. And as we've mentioned, those criteria, the age begins at 55, and almost all private insurances are mandated to cover this lung cancer screening if you are meeting those other criteria that we've talked about. So if you are 55 to 77, once again, have that 30 smoking pack years, currently smoke, or quit within 15 years, then your insurance should be picking up the tab on that preventative service for you. If you are not meeting one of those criteria and you are concerned and you do get an order for a lung cancer screening, we absolutely can still do a lung cancer screening. Currently, the out-of-pocket cost is about $143.
Okay. Let's see. John in Prescott Valley says, it's not John, it's Johnny. I've been cancer-free from breast cancer for 4 years. Yay. I'm also considered high risk for lung cancer because of my smoking history. Given my history with cancer and smoking, is low-dose CT screening right for me?
Well, congratulations on being cancer-free for 4 years. That is a really significant milestone. And you're right to think about lung cancer screening. The criteria would still apply to you, the age criteria, the smoking history criteria. But I would really encourage you to make the step of talking about this with your oncologist. If you are a cancer survivor and you're still under the care of an oncologist, you want to check and see if lung cancer screening is right, or if they would want to do some other testing like a standard CT because of your history of cancer. Now, rest assured, our oncologists do order the lung cancer screening, and that might be exactly what your doctor would want for you, but I would check there first.
Okay. Let's see, looks like John here. Are there lots of false positive and false negative findings with lung cancer screening using low-dose CT? What steps do you take to avoid these?
Yeah, that is an issue with all screenings, the false alarms. I will say in our program, I have not known of any false negatives. What is much more common is the false positives. What this most often looks like is we find a spot on the lung and we have you follow up with a low-dose CT in a few months instead of going to that annual. And then that nodule, that spot does not grow. So that's the most common false alarm. It is a little extra nuisance. Thankfully, it's not that big of a nuisance for most people. And as I mentioned before, we do have our expert radiologists, and we work really hard to benchmark national standards in responding to our findings on our lung screenings. And part of my job on the side is to continue that work so we refine. And even last year, new recommendations came out from the American College of Radiology that made false positives less common. I hope that answered your question.
Okay. Barbara says, what happens if my lung cancer screening uncovers cancer?
Yeah. Well, it is the point of lung cancer screening to find lung cancer, and that really does happen. In the best case scenarios, which is what I have seen many times here, we catch it early enough that you can be referred to a surgeon, a cardiothoracic surgeon, of which we have 3 here capable of removing that cancer. And in those cases of early detection, that might mean you don't even need chemo or radiation or other therapies. Ultimately, whoever orders your lung screening will manage the follow-up testing, but I am here in the background to help assist and connect the dots in any way I can.
Thank you. All right, let's see. This is from Diane. She says, now that there's a cancer screening exam, is it okay for me to keep smoking?
Well, Diane, I'm pretty sure you know the answer to that is no. But I also wanted to talk about a misconception that brings up a really good point. The best thing you can do for your health is quit smoking. That is common knowledge. But what is not common knowledge is that annual lung screening is a teachable moment that makes it more likely for smokers to quit smoking. I've witnessed that because it's this aha moment. Oh my gosh, we're doing this screening because the smoking could have caused lung cancer. Or maybe like that scan we saw earlier, we see something like emphysema. And for the first time, you have the physical proof that there's damage that smoking has caused. So no, it's not a free pass. If you're not able to quit smoking though, it is still important to keep coming back and getting your annual lung screening. That's when we find the most benefit.
Okay. See, Jody from Chino Valley says, I'm ready to quit smoking again. What have you found is the most effective way to quit and to quit forever?
Well, I hope your next quit attempt is your last attempt. It usually takes people multiple quit attempts to get there. So if you found yourself frustrated or disappointed in yourself, just know that that is often part of the journey. There is no one magic bullet. There's evidence to support that prescriptions like Chantix and Zyban or nicotine replacement greatly enhance your chances of quitting smoking. And power alone is often not enough. So I'd encourage you, if you have not tried any of those, to talk to your provider about those options. And if one doesn't work, keep going, keep going. There are lots of options out there.
Okay, it looks like our last question here. What are the experts saying about the damage vaping can do to your lungs?
Wow, that is an excellent question. So the jury is still out on the long-term damage of vaping. I'll say that right off the bat, that we don't know. Think how long it took for cigarettes to really know that that damage was really done. But we do know it can damage the airways and it can damage the blood vessels. The American Cancer Society says, if you used vaping to quit cigarette smoking, do not go back to cigarettes. And please do not do vaping and cigarettes at the same time, because then you sustain the damage from both modalities. So vaping, probably not a good idea, but if you're doing it instead of cigarette smoking, please don't go back to cigarette smoking. All right. Thank you so much for joining us today for our Healthy Conversations. And please know I'm here at 771-5454. If you want to ask me any questions, check out our wonderful resources on yrmc.org under the Lung Cancer Screening and Care Program. And I hope you have a wonderful day. Goodbye.